Kenya has recorded the highest number of daily COVID-19 deaths as 24 people succumbed to the virus. This now pushes the number of fatalities over the last 10 days to 158, an average of 15 deaths every day. 1,344 more people tested positive, bringing the total number of positive cases to 64,588. And as Dorcas Wangira reports, 287 people were arrested last night for flouting health and safety rules.
Kenya has lost 24 people in a single day to COVID-19, the highest number of fatalities to be recorded, bringing the number of fatalities to 1,154. 1,344 more people have tested positive, the second highest number after 1,494 November 4th, bringing Kenya's total caseload to 64,588. Dr. Vladimir Shukin, a bariatric surgeon specializing in the treatment of obesity, is the latest doctor to succumb to the disease, bringing to 22 the total number of frontline workers who have died from the virus. 2,108 health workers have been infected, 1,074 male and 1,034 female. 1,266 people are admitted in hospitals, with 58 in ICU. Nairobi remains the epicenter, recording 322 new cases and having 29,428 cumulative cases. The other top four counties with the highest number of infections are Mombasa with 5,689, Kiambu 4,139, Nakuru 3,062, and Kajiado 2,491. The least affected counties are Tana River with 35 cases, Marsabit 56, Elgeyo Marakwet 71, Mandera 73, and Wajir 78. As Kenya grapples with the second wave of infections, behavior change remains critical in making gains against the pandemic, but some Kenyans seem not to heed to the safety protocols. In Athi River, Machakos County, the police spent a better part of last night enforcing the containment measures. 10 bars were closed, 31 people were arrested, some resisted. Others looked for ingenious ways to escape arrest. None of the joints where the arrests were made had public health compliance certificates, including hand-washing stations, marked stickers to ensure that there is social distancing, which is an additional charge for the clubs and entertainment joint owners.
People are taking life normal, and this we can't afford to do that because this is an abnormal situation which must be handled carefully.
Raid will continue to make sure that Mavoko resident does not transmit the disease.
If that place is not compliant, we are not going to issue any licenses for operations.
Likewise in Kisii, in a similar operation, 22 people were arrested Monday night for violating the curfew regulations. More than 100 had been arrested previously. Others were arrested in public service vehicles.
For each and everyone to follow the protocols without being forced, because it is for each and everyone's own safety.
In Bungoma, 137 people were arrested. In Kisumu, the police commander has given a directive that no passenger should board any PSV without a mask. The Embu County Commissioner who led the operation had a different approach. He was first redemptive before he was punitive. Giving masks to those arrested before having them released. In Nairobi, public health officers conducted a sensitization campaign in Muthurwa Market. The hygiene status of the market is wanting, especially at this time when rain falls. Social distancing is not being observed. This is a potential super spreader site.
We decided to have this operation so as we can sensitize the community here in Muthurwa, because it's a diverse community. They come from all over the country, to sensitize them on a few activities.
Losing 24 people in a single day is almost as if one person died in each and every hour. The new infections and attendant devastation with every death is one the Ministry of Health hopes will be a wake-up call to Kenyans. Dorcas Wangira, Citizen TV, Nairobi.